Hi, this is Bob Barnett. I'm editor-in-chief of Cancer Health Magazine, and welcome to our first Cancer Health at Home video event. It's on Zoom and Facebook Live. I'll be introducing our panelists in a moment. First, just a little housekeeping at the bottom. If you're on Zoom, at the bottom of your screen, there's a Q&A. Feel free to ask questions throughout at any time. In the second half of this event, we'll look at the questions and we'll try to have our panelists answer some of them. Let me tell you a little bit about our panelists. Jeff Neurman is, his blog is It's in My Blood. Jeff has contributed to Cancer Health Magazine, and he'll be joining us. Next is Robin McGee. Her blog is The Cancer Olympics. It's also the name of her book, and she'll be joining us in a moment. And finally, there's Megan Claire Chase, who goes by Warrior Megsy, and her blog is Life on the Cancer Train, and she's also written for Cancer Health Magazine, and she will be joining us in a minute. And so, without further ado, panelists, please start your videos and let's start talking. Welcome.
Hello.
Hello.
Hi. So in the first half of this, I just want to go around and have you guys introduce yourselves. Each of you has a story to tell about not only your cancer and your experience, but how the pandemic has affected you. And I think you have some really interesting stories to tell that shine a light on a lot of the issues on the problems that are going on. Jeff, why don't we start with you? Tell us a little bit about yourself and how the pandemic has affected you.
Okay, well, thanks, Bob, and it's a great pleasure to be here and an honor to be with you and Megs and Robin. So I have leukemia. I was diagnosed about 7 years ago, and to be more specific, I have chronic lymphocytic leukemia, which is something I had never heard of before I was informed by my doctor after a routine visit that that is what indeed that I have. I don't really understand this, but I'm told that even though it's a leukemia, it acts more like a lymphoma, which doesn't really mean much to me other than I like to think that I'm particularly versatile. For the first 5 years or so after I was diagnosed, my life was essentially, as I'm sure many people with cancer can relate, a series of intervals punctuated by traumatic oncology visits. With my cancer, I don't get scans, I get just lab work. So I know there's the term scan anxiety. I don't know if there's a comparable term for blood cancer, but if someone has it, I'd like to know. I'd like to use that. But it would be just a build up to great anxiety about how my cancer was behaving or misbehaving as it was. And that continued for, like I said, for about 5 years until I finally had to undergo chemo for several months. And now I'm a couple years almost on the other side of that, but it's still been a real effort to put my life back into some sort of some semblance of normalcy. And in the midst of all that, COVID came along. And in some ways, I feel like and I'm sure we'll talk about this, I was better prepared perhaps than somebody without cancer because I was used to doing a lot of the things that one needs to do, you know, staying away from people who are ill and so forth. But it was particularly challenging for me because my wife is a doctor and she was dealing and continues to deal with patients that have COVID. And so as soon as it became an issue here in the greater New York area where we live, we really had to greatly alter our living arrangements because you know, mostly out of concern for me and my suboptimal immune system. So I've spent many a night on the couch since then. And it's been tough. Because it's when you draw so much support from your loved ones, particularly with something like with cancer, and then to have this distance that's imposed upon you because of some totally unforeseeable other illness, it makes it quite difficult. So anyway.
You also have children, right? You have,
Yes, and I have 2 children, and I mean, the one good thing about this, there's not much good to say about COVID, of course, but the one good thing about it is I found having cancer is a very lonely experience often, but because my kids could no longer go to school and so forth, despite the frustration I had as being the on-call IT person / homeschool teacher, it was comforting to have my kids around so much more. So.
Thank you. Robin, why don't you tell us a little bit about, you have a specific story about how let me just let people know, Jeff is in the general New York area. You're in Nova Scotia in Canada, and Megs is in Dunwoody, which is outside of Atlanta. So we have people from all over. But you had some experience in the Canadian system with a side effect of your treatment so tell us a little bit about yourself and what you went through.
Well, just by way of general introduction, I was diagnosed with stage 4 colorectal cancer in 2010. I was in remission for 7 years, recurred in 2017, recurred again, learned of the recurrence the day the lockdown was announced. So that's the very day the family doctor called saying your PET-CT lit up, you're back in that. But to talk about the impact of COVID then, so that was March 17th. I didn't start chemotherapy till the 25th of May. That's how long a treatment delay I had.
Talk about anxiety, right?
Yeah, talk about anxiety. I only talked to a surgeon last week, so that was another huge, just huge delay and anxiety-provoking delay. So I am in chemotherapy now, so I'm in active treatment right now. But what you're alluding to with the specific story is that as a result of previous cancer treatments and other treatments, I had developed escalating cataracts, which were bringing on blindness, like unusually rapidly. These aren't garden variety cataracts, they're a special accelerated kind. So I was told that, you're going to be blind in about 6 months. And then, of course, you can't really have these kinds of surgeries, eye surgeries, or you can't have a good outcome if you have them while you're on chemotherapy. As you know, they often say no surgery on chemotherapy, no intervention of any kind, not even dental. So the risk was I was going to either have to choose between an unopposed cancer and blindness. So because I had this huge delay in treatment, I was able to lobby the government. I called in my markers on Twitter and Facebook and my community in general. Everybody wrote letters and emails, etc., to the Officer of Public Health and the head of the health authority here, begging to allow me to be an exception to access a private eye clinic, and I was able to do that. So I was able to save my eyesight just under the wire. So I can see you.
It was considered elective surgery, so they locked down all elective surgery, and it was...
As a result, yes, as a result. And I want to know that the news media here in Canada really seized the story and spread it. It was on all our major newspapers. It was on one of our famous radio shows. I personally believe it was the media pressure on the government, the Nova Scotia government, that led to the change of heart, where they said, okay, you can go ahead as long as you're not using any of our resources, go ahead with a private clinic. And the private guy who reached out to me hearing about my story, he was able to save my vision.
Right. Well, it's an amazing story, and you've been an advocate for a long time, and it just shows you what you need to do. You leveraged media pressure, social media pressure, and your own advocacy to
yeah, and that's you really don't want to do the heavy lifting, right? You've just been diagnosed with cancer, right. The disease, you've got the anxiety, you've got COVID-19, and God, do I really have to beat the bushes to save my eyesight? But right. I did.
Oh, we're glad. Okay, let's introduce Megs, and tell us a little bit about yourself. And I know the pandemic has affected you in a very different way. So tell us a little bit about your story.
Sure. So I am Megan Claire Chase, known as Warrior Megsy on social media. And I'm also a young adult cancer influencer through my blog, Life on the Cancer Train, where I talk about the struggles and the trials for cancer patients, especially those that were diagnosed under 40, but also the general, cancer community. And so what you were saying there, Bob, is yes, I've been hit in a different way during this COVID nightmare because I am one of like the 40 million people that lost my job due to the pandemic. And because of that, it's been really difficult to see my specialist, because I lost my employer health insurance. And so I felt like 2019 was already a rough year. I had my 8th surgery last year. I had shingles, I had pneumonia. I was in the ER for severe dehydration and vertigo last year. So I was like, yes, 2020 is going to be awesome. Or kinda, like I'm going to get together. I was doing well in my job, and then COVID. And so
we're kind of on the cliff there with insurance, right? I mean,
yeah, like it was a major issue because I was losing my job and my employer benefits, health insurance, 2 days before my scheduled 6-month exams. And I schedule my scans 6 months in advance. So I was like, oh my gosh, what am I going to do? I kept calling, and it was really difficult to get someone on the line because COVID wasn't just affecting, companies, it was affecting hospitals, and they were having furloughs and layoffs, which I didn't know. And so that's why no one was like answering the phone like as promptly as they normally would. And at the time they told me, yeah, we can only get, one of your scans rescheduled. And I'm thinking, well, that's not going to work for me. I can't go into a pandemic with just like half a scan. But then when I was able to go, and when I got the MRI, and I was just telling the MRI tech, just chatting because I'm a teleker, and she was like, let me see what I can do. And they asked the tech who does the diagnostic mammograms if they would stay late so I could have everything done that day. So that was such a relief. So I am pleased to say I'm officially 4 years NED, which is no evidence of disease, of breast cancer, and I had stage 2A invasive lobular breast cancer. So it was definitely down to the wire and extremely stressful to get all of that done and navigate things to make sure at least I'm going into a pandemic without cancer, but I still have a plethora of other illnesses that still need to be managed and watched. And unfortunately, I'm not getting that full care that I need right now during this time.
Yeah, you need treatment for some of the serious side effects of your treatment that have been postponed because of the pandemic. Is that right?
Yes. I suffer from chemo-induced fibromyalgia, chemo-induced neuropathy. Gotta love chemo. And then I also have a bulging disc with a tear in my nerve. So I'm just in chronic pain 24/7.
Thank you. Sharing all this. And we're going to take a break in a minute, but one thing that if you could also just touch on the other pandemic that we've become aware of, although we've been aware of it for a long time, is racism. And you also have a story about how perceptions of you as an African American affected and delayed your diagnosis. Can you briefly tell us about that?
Yeah, so it actually took 2 years of just constantly going to the doctor and saying, I'm having these symptoms, but they weren't the typical symptoms that they would see for breast cancer. So no one thought this would be breast cancer. I had these green bruises only on my left leg. I had like this bump on the outside of my left breast that they told me, oh, it's a zit, don't worry about it. I had this unexpected weight gain. I mean, all these things were happening. I'm like, I know something is wrong, but no one was listening. And I just kept going to them over and over again. And then finally, it wasn't until I felt the mass is when I was taken seriously. And I really feel that, if they had listened to me, that 2 years ago, maybe we could have caught this before it even got, to a stage 1, let alone a stage 2A. And then I've also had issues where there have been like biases because of my race. Oh, you must have triple negative cancer because, you know, you're an African American and that's what's most prevalent in the African American demographic. Well, no, I have invasive lobular. Well, that is just so strange. I mean, are you sure you don't have triple negative? And it's like, why are you questioning me? I know my diagnosis, and just because the color of my skin like says maybe I should have this particular one, like you cannot judge a person by that because cancer does not discriminate. And it doesn't, you know, like I could have, that's why mine seems to like shock people when I tell them I don't have the, you know, typical one for my race.
Okay, well, why don't we take a break? We have a little video, a very, very short video about the Cancer Health at Home, Cancer Health site. And so why don't we go to that? And then when we come back, we can all, you know, extend the conversation and talk to each other. Welcome back to second half of Cancer Health at Home. Yeah, by now we've met our three panelists, and each of them has stories, and I'm sure they have many, you guys have many, many other stories to tell, but each of you has a specific, at least one, if not more stories about how the pandemic has affected you. One of the themes that clearly comes up with your stories is the importance of advocacy, self-assertion, educating yourself. And I wonder if any of you want to, you know, comment on that. A lot of times when people are newly diagnosed, it's an overwhelming experience. They're, as Jeff was saying, you know, he hadn't heard of chronic lymphocytic leukemia before, and why should he? You know, it's easy just to sort of say, well, they know what they know best, but they don't always know best. So tell me a little bit about your journeys to become your own advocates. I don't know who wants to start.
Well, I'm happy to go first and be the impolite and just jump in. But you know, my experience was that, well, first of all, I went through quite a few oncologists. I'm sure there are a number of them who would prefer not to ever hear my name again. But I found that, you know, one does, as you said, Bob, really have to be your own advocate. And I think in fairness to doctors, you know, of course, the vast majority of them mean well, but in my experience, there's just so little, you know, despite the great strides we've made in recent years, there's still so little that's really understood about cancer on so many levels. And I think Meg's story, you know, highlights this. I mean, you really have to know your situation and be your own advocate. And sometimes you have to be, you know, pushy or more so. And I mean, I'm lucky because, as I said, my wife is a doctor, and so often she could be my spokesperson. And so the hardest thing for me often is just to shut up. But you really do have to you know, you have to strike a balance, I find, between knowing what you need to know about your situation, your disease, and not overwhelming yourself with everything you could find on Google, because then you're just going to go crazy and nuts and you hear all kinds of things that aren't true. But yeah, one really does have to be their own advocate.
Yeah, thank you. You know, Megs, in your story, did you go through a process in which you realized, once you realized, you know, you got your diagnosis and it took a long time, that you needed to really stand up for yourself to get the care that you needed? Was that you know, are you different now than when you were first diagnosed?
You know, yes. I really found my voice, my patient voice during all of this. And like Jeff said, you know, sometimes you do have to be pushy, and it feels uncomfortable to be pushy, but it's like at the end of the day, this is your life, you know. You've got to fight for it. And I've learned also to like trust my instinct, and that if I don't feel a doctor is really listening to what I'm saying, you know, because this is cancer, not the flu. And if I can't trust them with my life, then I know it is my patient right to say something. And if that doesn't get corrected, then you know what? Let me try and find someone else or get a second opinion. And so it's just so important to know your body, but also trust your intuition. And it's going to be uncomfortable. Even the most vocal person, when you are all of a sudden sitting in that exam room with your hospital gown on, you feel very small and vulnerable. So it does take a moment, even for the most vocal of people, to still find their voice when you're sitting on that table in the exam room. And so I learned early on that it's going to feel weird, but I have to do it because I'm worth it. My life is worth it.
Yeah. And Robin, you wrote a whole book about about the many mistakes that were made in the and we can't go into them all now, but I encourage people to get your book and read it because it's a great.
It's not unlike Meg's in the sense of having symptoms and immediate family history and a positive cancer screening test, all of which were ignored by 4 doctors because they said, you're under 50, no scope for you. So I was stage 4 by the time of my, the cancer was detected after years of the same kind of pursuit. So anyway, long story short is that I want to balance, I understand what Jeff is saying about the balance, but I also want to say, having experienced a lot of medical error, the informed patient is the safer patient. I want to say it again. The informed patient is the safer patient. If you're out there and you're newly diagnosed, you really do need to know what the standard of care is so you can hold your care team accountable, because people are tired, people are busy, the fax goes missing, there's all kinds of things that happen, and you've just got to stay on top of it all the time.
I would just want sorry if I could, Bob, just one other thing. I mean, my experience is that in addition to obviously finding a doctor that's competent or doctors that are competent, I feel like it's so important to Meg's point, you know, that you're entrusting this person or these people with literally your life. And for me, it really is also about finding someone that I'm comfortable with, that I personally feel that I can connect with, that, you know, they don't have to be my best friend, but that I really feel comfortable and safe talking to them about concerns. And, you know, maybe it does, you know, they all have great credentials, but if they're not the right fit for one, you know, personality wise, I think it really can interfere with the with your treatment.
Absolutely.
Just we have a question from the audience, which is, let me just read it. Can you talk about how you address your mental health? Because you started, you know, all of you, Jeff started talking about anxiety. Each of you have talked about anxiety, and then the anxiety has been multiplied many times by the way the pandemic has affected you. I recall a blog post you wrote, Jeff, in which you said that that many people who don't have cancer are now experiencing having to live with uncertainty and having to live with fear that many of you have learned to live with. So what have you done? What are some recent issues with anxiety, and how do you handle your mental health? I don't know who wants to go first, but I can choose somebody, or just raise your hand.
Well, I'm happy to go first again.
Okay.
I just never shut up. Let's face it. I was always an anxious person, but what I've found is that having cancer tends to bring out some of one's worst personality traits. And so having cancer made me much more anxious, and then chemo really ratcheted it up. And then COVID hit. And it got to the point where I decided one day in a fit of anxiety that the food supply would run out, and therefore I started growing literally vegetables using hydroponic methods in my basement. So that's how, concerned, I got, and I realize like sometimes I'm being irrational, but the anxiety becomes very overwhelming. But as you were saying, Bob, I think, yeah, people, I think, understand we're struggling to make sense of COVID and the, every day you turn on the news and it seems like there's nothing but dark days ahead. And unfortunately, that's something that I think when you have cancer, you learn, or you're forced to deal with, that there's just uncertainty, so much uncertainty. And I mean, I wish, I think having therapy is great. A nice cocktail sometimes helps.
But not two
or more than one. But it's a very challenging thing to deal with, the uncertainty and that's caused by all of these things.
Well, I know for me, my anxiety has gone sky high, and to the point where I was not sleeping. I was having all of these nightmares. And so I realized, okay, it's time for me to call my primary and talk about this, because I, stressed out being unemployed. And what does that mean? Stressed out making sure I have my medications, which now there have been delays because of this whole nightmare with COVID and, trying to get your medication. And so it's just a really stressful time. And I'm single. And so I have to go out sometimes. I can't just, order everything and have it be delivered. I actually have to go out. And so that kind of stress and anxiety is just at a different level than it was during the cancer days. And so I'm actually now on an anti-anxiety medication, and I am fine with that. Like, I reached out for help, and it is okay, because this is a lot to deal with. And then on top of trying to, keep the body healthy, it's just insane. And also, trying to know my body now, like I still actually call it this body because I don't feel comfortable with it. And it's like, okay, is this because I'm anxious about a medication or something going on with my health, or is it from the, outside of what people are doing and not wearing masks? I mean, it's just so much going on that I think it's really important to recognize the signs in your own mind and body. And when you need help, to ask for it and don't delay, and, get the therapy if you need it, get the medication if you need it, and that it's okay to not be okay.
And I guess Megs and I were talking about, and all of you were talking about this the other day, that for me, in this place that I'm at, which is, do you go ahead with huge, horrific surgeries, or do you die sooner without that surgery? What do you do? Quality of life, all those judgments, etc. The anxiety is so far off. It's off the planet. It's moved into outer space. It's way out there somewhere. So what her advice is, you just be true to yourself. Be true to whatever your essence is. And so, in my case, my essence has been, what's the bravest thing that I could do? And the bravest thing would be to take on this horrible surgery. Once you make those decisions like that, or just try to connect with your own inner nature. And not everybody has that kind of, I want to do surgery nature. Other people would say, I'd rather do a Zen, peaceful, slide out of life. And that's great too, but it's as long as it's true to your own self. And that's what I would say about it.
Once you've made that decision, that you felt more relieved about your...
Well, I still don't know that surgery is really an option, because there's still pennies to drop, but after this MRI today, but if it's an option, I would pursue it.
Will do. Speaking of anxiety and the pandemic, each of you at some point needs to leave your house, even if you have other people to bring groceries in. And there's been a lot of, debates in this country about wearing masks, and how do you feel about being immunocompromised and being out in a world which is suddenly more dangerous for people because of COVID? Have you had experiences with Megs, you're in Georgia, which is now having a lot of fights about masks between the governor and the mayor of Atlanta. But all of you have had experiences. What have your experiences been in terms of going out and whether you've felt safe or not safe?
Well, I know for me, and of course, Georgia opened up very early, which was crazy. But I actually would get looks from others who would not have a mask on. Like, they would give me a look like I'm the crazy one, and so I just know I don't want any confrontation. But I would just look at them because the mask, covers my face. They can't see all of me, so I can give them the looks of death, like, doing, right? But I would only go to the stores that actually enforced wearing a mask, like Costco, love them. That's the only place I would feel comfortable going shopping. But I've noticed lately here in Georgia, because of the rise of cases and what's going on with the governor and the mayor of Atlanta, and I've actually seen more people now wearing masks, which is encouraging. It's a shame that it's had to take this long for people to wake up. There's still some that don't, but I just know that I'm only going to the places that enforce the masks, and I'm going in and out. Like, I have my list. I'm not dilly-dallying or anything, in and out, and then come home.
Yeah. Well, let's hope that that wearing more masks in Georgia helps the incidents come down. So, anyone else have experience?
I guess I just want to comment on a sort of a satellite aspect of this, and it has to do with we cancer patients often have a bucket list. And the problem of part of the grief of COVID-19 is that you can't access the bucket list. So if I'd love to see Paris or the end, can't go. Can I see my loved one? What about my great aunt? I'll never see her again. Like, all of these things that happen when you are, it's like all of these pleasures that we use to try and keep us going and things we look forward to as survivors. If we survive, but now we can't even access those. So there's a loss. There's a sense, for me, there's a loss attached to being cut off from family and being cut off from travel and being cut off from the pleasures like shopping, like going to movie theaters, like all that stuff, which we can't do right now.
Yeah.
That's a really good point. Even just, like, I miss just like standing in line, getting some coffee and just talking with, some random stranger and really enjoying that interaction, but now I'm like, even if you have the mask, I still don't want you talking to me, like, stand that 6 feet apart. So I totally relate to what you're saying, Robin, is there is a different sense of loss, and there's this loss of time, because we're never going to get this time back. And we've already, as cancer patients, lost so much time. And now it's a whole other time.
I guess it's a whole different feeling to say, well, you can go to Paris maybe in 2 years. I mean, that means
not 2 years, you don't get to go.
Right.
Yeah.
So that for people like me in stage 4 situations, it's just feels like a desert.
Yeah. Well, one or two more questions, and we can't go on forever. But one of the things that you've, I think, all experienced is telehealth, and that's been bigger. Has your experience? I know that it's not ideal, and I know, for example, Robin, you had said that you're actually in active treatment, and you actually haven't been able to meet with your oncologist.
Right. No doctor has laid a finger on me since.
Yeah. So maybe that's a negative, but what have you had experience with telehealth, and has that made some of the care issues better?
Yes, I've had 2 telehealth consults with a medical oncologist, both of which I actually found, in some ways more benign, in the sense that you didn't have to drive, it's an hour's drive away from me, et cetera. So that was easier. We were able to sort of stay focused. He was commenting that when people are there in person and they have the mask on, he can't see their faces. And so he needs to kind of see people's skin and so on to judge their reactions to the medications, et cetera. So from his point of view, it was superior. Also, your spouses can join you, which in our system, we could not have people with us on cancer appointments. So we patients have been advocating for telemedicine for years. And now that it's arrived, I think the medical establishment is going, this is gospel. We should have been doing this years ago. And my hope is once everything settles, the dust settles, that telemedicine will continue and doctors will get appropriately compensated for that time spent that way, because it is way, way more efficient. And speaking of cancer and the challenges of getting to faraway appointments, it is beneficial.
Yeah. Jeff, Mix, have you done telehealth?
I had to, well, I was scheduled to have my regular oncology visit right before everything shut down. And so it was actually supposed to be right after everything shut down, and my oncologist fortunately had the foresight to say, please come in early because we don't know what's going to be like. But since then I have had one telehealth visit, and I have mixed feelings about it. I totally agree with Robin. Like in a lot of ways, it was much easier for me. Like I didn't have to drive and all this. And I was at home, and that gives me a sense of security. But you know, some of it, for one thing, I had to go for my lab work in advance, and there's nothing I dislike more than waiting for the lab results. I mean, that's usually the worst part of anything. And so that's I had to wait several days. Normally I would just go and they would do it and I would know in a few minutes. And then also, I mean, I guess it was a satisfactory examination, but typically my least favorite part, other than waiting for the lab results, is having the doctor check my lymph nodes, which is a little awkward and embarrassing. But you know, they couldn't do that. And so I don't know how important that is, but they're always doing it. So I don't know. And I just felt also, my doctor's terrific and I love her. But I did feel like there was a certain element of distance that was created by the fact that we were not in the same room. But I mean, again, I'm generally in favor of it. It just felt a little odd to me.
Well, Jeff, like I hear what you're saying with that too. Like I feel like the telehealth medicine would be great for like the non-critical, you know, reasons to go, you know, because it definitely saves on time. It saves on money. I know at least here in Atlanta, if you're going into the city, you've got to pay for parking, you know, like, I mean, it's a whole big deal to take that time off work and go through traffic, pay for parking. But like you, like I have to be touched. Like the doctors actually have to touch me, my body, to feel certain things to make sure that hopefully nothing is there or swollen. So I think it just depends on, like, I think maybe they should come up with like a list of the certain types of visits that would be appropriate for telehealth that would work. But then we have others where we really do have to be seen in person. And as scary as that is, during COVID, because I was just at Emory University Hospital last Wednesday, and they are taking precautions with that, but I had to be seen. So I think it's definitely, you know, we'll have to see how that goes in the future.
And so I have a quick question. This comes from the audience for you, and then I have a question, a final question for all of us, because we have to wrap this up. Somebody has written in about your comment about this body. You refer to this body. Yes, I have this experience too. Can you share how you reconcile this self-sense?
You know, that's a really good question. Thank you. It's a difficult one because I still can't get used to this body because so much has changed and my quality of life has changed. And so when I see all of the scars and even, you know, this Chia Pet curly hair is not mine. Like I had bone straight hair pre-cancer and this is going on 4 years. So this is permanent. Like your hair can permanently change. So when your whole like look changes and then you look like a railroad track, it's really hard to reconcile that. And so to me, it's like a constant grieving every time I look in the mirror. So I don't think I'll ever be able to call it my body because there are just too many things going on for me to even feel comfortable in it. When I'm in pain, you know, every single moment of the day. Like right now, it's a pain level 8, you know, so it's like, what do you do? So it's just really trying to take it each moment, each day, and finding one thing I like about myself, which are my eyelashes. And so that's when I'm like, you know what? We'll work with that today. But the rest of this body, I think it'll always feel like a stranger to me.
Well, my 2 cents is I like your hair, but that's.
Thank you.
And then finally, you know, we had a really great conversation when we were talking about this, about how you each find strength to carry on, how you keep you know, positive. There's a lot of conversation about positive. No, a lot of times people with cancer feel they are forced to be positive because that's what the media often, you know, trumpets. Wow, this person, you know. And I think the actual experience of finding your own way is really different. And I wonder if each of you can wrap up and tell us a little bit about what you think, and even to address it to people who are newly experiencing cancer and trying to figure out how they can handle it themselves. So I don't know who wants to start.
I'll start on that. I'm a clinical psychologist in my day job. So my whole life is, or has been up to now, anxiety and depression and people's mental health and so on. And so when I was first diagnosed, one book I read that was very helpful to me was Chris Carr's book called Crazy Sexy Cancer. And in it, she says, you know, there's this relentless pressure, be positive, or you're gonna die. That's just not realistic. And so people suffer because they have to repress their feelings all the time, and that harms them. So in her book, she gave the advice, which I found lovely and permission giving, and I want to share it here, is that you're allowed to wallow in despair over your diagnosis for 3 days. So if you feel, God, I feel sad about this, go ahead, let yourself be sad for 3 whole days, give yourself that permission, and then after the 3rd day, you'll pony up and move on to something else. But I personally found that I didn't need 3 days as long as I had permission to feel the sadness, because my family and friends were saying, no, positive. See, I just can't be positive all the time. I just can't be. This is just too sad.
You shouldn't have to be.
Yeah. So my advice to people who ask, how do you cope? Is it just feel the feelings, whatever the feeling is. It's anxiety, it's fear, it's happiness, it's love, whatever the feeling it is, just let it happen. Don't fight it. Just allow it to be. Even when we talk about scan anxiety, go ahead and feel it. Of course you're going to be anxious. Don't try and fight it, because you'll only just push it down and it'll just come back strong. So one thing we know about emotions and how paradoxical they can be, sometimes you just have to let go.
Who wants to go next?
I'll go. So for me, and I totally agree with what Robin says, like, it is impossible to be Pollyanna 24/7. And so I feel all of the feelings, right? But I've also learned when to ask for space, because you'll have a lot of people coming at you saying, you know, you can do this, you can do that. And I'm just like, okay, you've not been through what I am going through right now, and you don't understand. So I'm just going to ask for some space. And that is totally okay, because this is the time for you to put yourself first. You have to be the priority, because this is your life. And also, like, reach out for that support. Like, there's such a huge cancer community, and I know I'm part of some really great groups like Elephants in Tea and Lacuna Loft. And I have found that weekly support of talking to others, because they totally get it. You don't have to explain anything, because as well-intentioned as our friends and family are outside of the cancer world, there are going to be some things that they will never be able to understand. And so when they keep telling you to be positive, it actually becomes hurtful. And so we have to make sure that we find different outlets that we can release those feelings, because it's going to be a lot, and it's important to not repress them, but like Robin said, like, to feel them and let it pass.
Like a wave.
Yes.
Jeff, you get the last word.
Oh no.
And for you,
And on a high note,
I can tell you that green tea extract is going to cure you.
yeah.
That's the biggest one, right?
Well, I agree with everything that Megs and Robin said, of course. I mean, how could I not? But I do think one has to just be true to who they are. I mean, I am not a positive person. I call that realism. Some people call it pessimism, but whatever. And so for me to try to shoehorn myself into a positive attitude when I'm dealing with what is undoubtedly the most negative thing that's ever happened to me, that's just an extra battle that I did not need to wage. Fortunately for me, I have a great supportive family, and for some reason I was blessed with the ability to find humor and all this nonsense that I'm enduring. So those things help me, but that's what works for me. And I just think that, to Robin's point and Meg's point, whatever works for you, that's what you should do. If you feel a certain way, you should feel a certain way. I might need it a little more than 3 days, when I'm feeling bad, but maybe I can get an extension. But I just think you have to be true to who you are, because you're dealing with enough, and to try to fit into some other person's notion of how you should be is just asking, in my view, too much for yourself, and it's not fair to you. You just need to focus on doing what works for you.
Well, I want to thank all of you. You've been wonderful, and it's been really great to get to know you over preparing for this and having this event, and really appreciate you participating in the first Cancer Health at Home. I hope we'll have many more. And the people who are watching this, you'll see a screen, cancerhealth.com at home. You can find the bloggers, their websites on Cancer Health, learn more about them. We'll be posting this very soon if anybody wants to share it with anybody. And thank you very much.
Thank you.
Thank you.
You.